All right, good morning, everyone. Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Brain Health. And today we're talking about concussions and conclusions. So basically, this is going to be a synopsis of the last 12 broadcasts we've done on concussions. I didn't realize that we had done so many broadcasts on concussions, but nonetheless, I think it's pretty cool. And as I was saying to the fine woman that put together the presentation yesterday, we're just scratching the surface here. There's so much to talk about. Literally, I could talk about this for probably 100 hours. So, we could just go on and on and on. There's so much exciting information about MTBI, also known as concussions, also post-concussion syndrome, also this new entity. Well, it's not necessarily a new entity. I want to be specific on that, but the entity that has gained a lot of ground and seen in former athletes who have played contact sports, chronic traumatic encephalopathy. I will make the retraction that I believe that I said Dr. Omalu formerly named chronic traumatic encephalopathy. I think it was actually named in 1957, but he was the one who really put it on the map. He was the one that demonstrated in football players. So yeah, good morning to everyone who's joining, and hi, and I hope you're all having a great Saturday. So we're gonna go through these slides. I have like 50 slides to go through. So I hope this brings it all together. And let me know what you think. So I'm going to go away from Facebook. I'm just going to be looking at my presentation. I'll come back to any questions at the end. All righty. Okay. Here we go. Concussion conclusions. So we talked about concussions and fatigue. We talked about concussions and leaky gut syndrome. We've talked about concussions in the adrenals, concussions and low testosterone, concussions and low estrogen, concussions and SPECT scans for imaging. We also talked about blood tests for validating concussions, volumetric MRI, the brain MRI for concussion, as I term it, diffusion tensor imaging, and then eye movement testing, and chronic traumatic encephalopathy. Okay. So what happens in a concussion? So I think that's really important to know, and I think also it's important to say a big reason why we're doing this, this 12-part series on concussions is that so many of those who have concussions have a head injury and they're told, you know what, your CT scan is normal, your MRI scan is normal, go home, rest, and if that doesn't work, maybe go see a physical therapist, maybe go see a neurologist. And oftentimes, if someone is not better after 6 months or a year, they're just kind of left to, hey, we don't really know what else to do. Let's just keep trying different medications to palliatively treat the condition. So that's kind of the standard that's out there. So for those who suffer with post-concussion syndrome, lots of times they're befuddled. They don't know why. They're not feeling normal. They look normal. As one of my patients said, it's the invisible injury. So here I'm trying to show you the invisible and making it visible. So this is a seminal article from 2013 from the journal Plios 1. This was looking at the astrocytic protein S100B, and they basically showed that this could go up after head injuries and subconcussive head impact. So not even concussions, but this is where they measured this protein from the brain in the blood of college football players before and after games. I think they did it for 3 games. They looked at about 67 subjects, and they saw that those who had the most subconcussive head impacts, because they basically videoed the football game and they saw those who were hitting their head the most, had the highest S100B. And I still have to circle back to the question from a week ago as to how long this remains elevated. I can't say for how long, but I will get back to that. So anyways, this brain protein is elevated after football games. So interesting. And then, okay, so if we have a brain protein now floating around in the blood, that indicates this thing called the blood-brain barrier is permeable. So your immune system in your body is different than your immune system in your brain. Why? Because if you sprain your ankle, most of you have seen someone who've done that, or you've done it, and your ankle becomes huge. When you have a brain injury, you do not want that much swelling because the brain is within the skull, and there's a limited anatomical space for any of that inflammation to go to. So we now see that basically this brain protein is now in the blood after subconcussive head impacts. So that's interesting. So the blood-brain barrier has broken down. And the thought is that, well, if this brain protein is now in the blood, what out in the blood is now going into the brain? And that's what this article shows. And I don't think I really highlighted this point too well when I talked about the blood-brain barrier issue. But your microglia are like Pac-Man. So think of like I don't know if you've heard of like a macrophage. These are like little Pac-Man type guys going throughout our body, and they see something bad and they engulf it and they swallow it and then they basically kill it. So we have these microglia in the brain, and they're in our brain to basically get rid of inflammation, fix the situation, and then calm down. Whereas, as I mentioned, the inflammation in our body is more there to like go nuts if something happens. So here they showed that basically after head injuries, let me see here in this article, they demonstrated that this type of microglia stayed activated for a long period of time. I don't know, did I not attach that? Let me see here. Yeah, here we go. So here they said, while the increase in M1 markers quickly resolved after a single concussion, they persisted following repeated concussions, indicating a pro-inflammatory environment induced by multiple concussions that may delay recovery and contribute to long-lasting consequences. Basically, the M1 microglia is the guy in the brain that kind of goes nuts and it can stay on. The M2 microglia is more of the reserved microglia, and they're trying to keep things peaceful, so to speak, in terms of the inflammatory response. So that's interesting. So now we have a blood-brain barrier breach, proteins from the brain going to the blood. Perhaps now we have proteins from the blood going to the brain. And what can happen is when that happens is that then these microglia get turned on and they stay turned on, particularly after subconcussive head impacts or multiple concussions. This is the line of thought. Okay. So kind of interesting. Now your mitochondria make energy in your brain. And the classic description of the mitochondria is that it's the powerhouse of the cell. And abnormal mitochondrial function has been demonstrated after brain injury. So if you're a concussion patient and you just can't think, or you're a concussion patient, you're like, man, I can only read for 20 minutes. I used to be able to read all day long. Well, maybe you have a mitochondrial problem. And it's all throughout the literature that mitochondrial issues develop after brain injuries. So now we have a blood-brain barrier problem potentially. We have inflammatory immune cells turned on. Now the mitochondria are not working. And then we can have damage within the brain to the axons. What are axons? Axons basically, for all intents and purposes, are wires. So now the wires that come out of your gray matter down to different parts of your brain, those wires can be stretched. They can be kind of twisted, so to speak. And then with a certain type of brain imaging called diffusion tensor imaging, we can actually now look at those wires and say, whoa, they're not normal. And diffusion tensor imaging used to just be like a research phenomena, but now it's so exciting because diffusion tensor imaging is now getting into the clinical world, not everywhere. I've worked in some cities where it was located. I've worked in other cities where there's no site of diffusion tensor imaging coming to the town. But this is a really, really interesting modality for validating concussions. So if you hear somebody talk about white matter injuries, that's what they're probably talking about. So in this article, they basically showed that persistent signal abnormalities in diffusion imaging metrics at return to play following concussion may be predictive of a repeat concussion. This may reflect a window of cerebral vulnerability or increased susceptibility following concussion. What does that mean? In this study, they basically took a group of athletes who had concussions, and the athletes were feeling fine when they went back into play, but if they still had signs of white matter damage and evidence of inflammation, which we can now track with what's called MR spectroscopy, then they could predict who is going to get a second concussion. So this is changing the game too for athletes you know, are the metrics, so to speak, that we're using between different neurocognitive tests or different sideline tests, are those valid for saying an athlete is healthy to go back? Because so often an athlete, is your hamstring better? Is your hamstring painful when you're running? Yes or no. But the difference between a hamstring and a brain is that if you have a damaged brain and you damage it further, it's a lot harder to heal. And clearly we're seeing that with chronic traumatic encephalopathy versus if you keep pulling a hamstring, it's not going to probably impact your life as much long term as a repeated brain injury. And this was a phenomenal study. It's from 2019. This looked at veterans who had suffered blast injuries, and they basically showed that 1 year doing diffusion tensor imaging, they saw changes, but it wasn't until they did it at 5 years that they really saw dramatic signs of neurodegeneration basically in their brain. And if they hadn't done that 5-year endpoint, they probably would have missed that we're seeing basically this accelerated brain aging at the 5-year point, but not at the 1-year point. So one of the biggest concerns now for those who have suffered blast injuries or you played some sort of contact sport is, am I going to develop something like chronic traumatic encephalopathy? And I'm going to talk about the best ways we know how to identify that at this point, aside from the post-mortem evaluation, which is the gold standard, really the only technical way you can say someone has it. But here, doing diffusion tensor imaging, looking at the axons, we can see signs of accelerated brain aging 5 years after people have suffered blast injuries. So that's pretty phenomenal. Let me see here. Okay, I don't think you need. All right, so who develops post-concussion syndrome? I love this article. It's from Plios 1. And I put all these articles here not to be, just to say I have all this information. Just you can go look it up. So go to a library, go to a medical library, and a lot of these are open access. So you can go read these studies if you are interested in doing so. So in this article, they said, in contrast to the prevailing view that most symptoms of concussion are resolved within 3 months post-injury, approximately half of individuals with a single MTBI, which is a concussion, demonstrate long-term cognitive impairment. Whoa. Because a lot of studies have said, in the adult population, maybe 7% or so. I mean, estimates vary from let's say, I remember some studies that would say 7% of people, adults who had a concussion, will develop post-concussion syndrome. Maybe it's around 15% of those pediatric patients will develop post-concussion syndrome. And the sad thing is, I think it's Annals of Neurology, either 2018, 2019, they basically said if you're having post-concussion symptoms after 1 year from the head injury, you're probably going to live with those for the rest of your life. So that's where it's so important to get these head injuries treated soon, efficaciously, with somebody who knows what they're doing. So here, this is saying half of concussion patients have neurocognitive effects, long-term cognitive impairment, after 1 year, half. So if that's not a little disturbing, I don't know what is. Maybe that's a little dramatic, but you know what I mean. I mean, in all sincerity. Because so often concussion patients, again, are told that, you look normal, there's nothing wrong with you. And then if you're contesting, hey, I was fine before I had this head injury and now I'm not fine, then of course the other side is going to basically do everything to discredit you and say, no, you had this or you had that, or you're making this up and concussions aren't real. This is kind of the world of mild traumatic brain injury. Now, then I talked about leaky gut syndrome. So now we have all these brain effects. And I talked about the blood-brain barrier and brain proteins out in your blood, and then these immune cells in your brain getting turned on. And the more head injuries you have, the more they stay turned on. Well, unfortunately, with leaky gut, we can't do a lot of human studies. So they had to do these studies on rats. And when they did these studies on rats, they basically showed that the rats, this is looking at a protein called GFAP. And so GFAP is, and I always kind of mispronounce it, glial fibrillary acidic protein, I believe is how you pronounce it. But they basically showed that 28 days after the injury, and particularly if these mice had some sort of abnormal gut bacteria introduced, you see this GFAP in different areas start to get super expressed. So the GFAP in the, I believe this was in the intestines, got expressed abnormally. And then here in the brain, this is without being exposed to a pathogenic gut bacteria. And then this is what happened to their brain. This is the damaged area. It totally expanded when exposed to a gut pathogen. So how does that happen? Everybody's talking about the gut-brain connection. This gut-brain connection is occurring because now there's inflammation here at a higher level. We're also seeing that the gastrointestinal barrier breaks down. Barrier integrity is huge. So our blood-brain barrier is like a pipe. Our gut barrier should be like a pipe. And when that becomes like porous, where if you poked 100 holes in a PVC pipe and water spewing everywhere, that's kind of the analogy. And now you have inflammation from a gut pathogen, and now the brain damage expands. That is pretty astounding. So that, for people who are wondering, why do I have these symptoms? Well, now you can start to understand, well, now my brain proteins are out in my blood, and now my gut, potentially things you're eating, potentially your microbiome is creating inflammation that's then, because your blood-brain barrier is broken down, is then activating your microglia. So your microglia are now creating more inflammation. So what would have been a zone of injury like this is now a zone of injury like this. And no wonder you haven't recovered. Concussions and hormones. So hormonal function is hugely important to assess for. Here they're looking at basically testosterone levels and erectile dysfunction in former professional U.S. style football players. You know, look up the symptoms of low testosterone in men. They're going to have, you know, more fatigue. They're going to have a tendency for feeling more depressed. They're going to have low energy. And then here, looking at estrogen levels in women is huge as well. Know that adrenal hormones seem to be kind of differently affected in men versus women. It seems that men, if I remember correctly, they go into a state of low cortisol, whereas women tend to go into a state of high cortisol, high DHEA, if I remember correctly, definitely high DHEA. So if a woman's, you know, if you have a head injury and you're a female soccer player, and then all of a sudden now you're developing signs of high testosterone, like your menses are becoming irregular or growing facial hair, things like that, this is what you want to look at in terms of this relationship. And then catecholamines are huge. What are catecholamines? Adrenaline. So adrenaline goes up after head injuries. It's been substantiated so many times. And now they're looking at using adrenaline blockers, referred to as the beta blocker family. Sometimes they use alpha and beta blockers. And these medications block adrenaline, and they find that it's actually protective to the inflammatory response. Why? Because we're only supposed to be stressed for like 20 minutes. We're not meant to be stressed for days or weeks or months or years. So this is really important also. And then we have POTS. POTS refers to postural orthostatic tachycardia syndrome, which ties in with high adrenaline. And simply in this study, they found that like 2/3 almost of post-concussion patients had vascular dysregulation. By that I mean 2/3 of patients, I think it was either 2/3, 70.6%, had an abnormal tilt table test, which means their blood either stayed down in their lower extremities and their blood pressure went down and their heart rate didn't change, or their blood pressure went down when they went from a laying down position to an upright position, and then their heart rate went up. So irregardless, 70.6% of the patients, blood in the lower extremities, and either heart rate stayed normal or heart rate elevated. This is hugely important because if you look up the symptoms of orthostatic hypotension or POTS, you will see symptoms such as fatigue, headaches, brain fog, difficulty thinking, lots of times associated with gastrointestinal problems like bloating or small intestinal bacterial overgrowth, histamine issues. But namely the symptoms of fatigue, headaches, and brain fog. And they found that 70.6% of post-concussion patients had it, and when they corrected this, the post-concussion syndrome went away. Kind of wild. And I'll circle back to why that POTS phenomenon is probably happening. And then we have the element of, okay, so now we understand all these features of concussions from, the blood-brain barrier and microglia being activated and the gut being affected and how your gut, maybe your gut bacteria or maybe foods you're eating. I can't cite you a study right now, maybe I just haven't found it, showing different food intolerances and post-concussion syndrome, but I will tell you, I think I'm observing that. I've seen patients eat something and then all of a sudden be banging their head on the wall who are retired, professional athletes. So this is really, really, really important from the brain inflammation to the gut inflammation standpoint, high adrenaline, looking for things like POTS. So now you're saying, okay, I understand this. I want to know if I'm still showing signs of a concussion. And a lot of that may be predicated on what resources are around you, what size city you live in, what types of imaging modalities are readily available, and if your doctor is going to be willing to order them. So PET scans and SPECT scans are basically going to be the most commonly available tool that you're going to see. And SPECT scans, what do? They look at blood flow, in essence. And the unifying feature we see amongst concussions is a reduction in blood flow in the frontal areas. Why? Because most of the time we're hitting our head in the frontal areas. So they see characteristically a lack of blood flow in the frontal lobes. SPECT scans basically give us this beautiful image, and there are other doctors in our nation who use SPECT scans for things like concussions and diagnosing psychiatric illness, and that's all well and good. I think SPECT scans are a great modality to show you something wrong with your brain, and they're visually super impressive. But I think there are other modalities that really more represent the injury. So this is just basically saying what I just said. And then there's volumetric MRI. Volumetric MRI is so cool because with volumetric MRI, we can say, okay, what is the density of your dorsolateral prefrontal cortex? What is the density of your cerebellar gray matter? What is the density of your overall gray matter? What is the density of your memory area? You've heard the term neurodegeneration. So like Alzheimer's is a neurodegenerative illness. Chronic traumatic encephalopathy is a neurodegenerative illness. So, sorry, I'm just making sure I'm on time. I'm not going too long. So we can look at degeneration lots of times by looking at volume. It's not a perfect match, but it is a nice window into seeing what's happening. And so here they're looking at limbic system structures in retired professional football players. What is the limbic system? The limbic system, which I believe in Latin limbus refers to border, the limbic system borders the corpus callosum. The corpus callosum is the main white matter structure that binds each of your hemispheres together. If you have a head injury, what happens? The brain lots of times twists. When the brain twists, just as my mentor would say in seminars, Dr. Carrick, it's like a towel. So if you wring a towel, where's most of the force? Most of the force is in the center of the towel, and that's where the water is going to be squeezed from. So as we have these rotational traumatic brain injuries, lots of times the corpus callosum is going to be affected. We're even seeing the brainstem in football players be affected. So here, we're looking at the limbic system structures. This is your emotional processing area, the cingulate gyrus. They're also looking at the memory area, referred to as H, and the amygdala, which is your fear center. Because what are a lot of the symptoms we're seeing in chronic traumatic encephalopathy? We're seeing behavioral changes, impulsivity issues, anger and aggression issues. Those are particularly common in the younger cohort of chronic traumatic encephalopathy patients. In the older cohort, they're seeing the same symptoms, but also a dementia-like illness with significant and profound memory loss. So here, looking at the volumetric MRI, they saw atrophy, in essence, in these limbic structures. Atrophy meaning shrinkage in these retired professional football players. That's huge, because right now, chronic traumatic encephalopathy is a post-mortem diagnosis. It is a diagnosis that has to be made looking at the brain and fine sections under a microscope with staining procedures to see the density of certain proteins like tau throughout the brain in a characteristic pattern. But now with volumetric MRI, we can say, whoa, okay, you played football, let's get a volumetric MRI on you, or you played rugby, or you were a boxer, and let's get a volumetric MRI and look at the density of your emotional processing area compared to 3,000 plus age-matched controls from the NIH databank. And then this is just more discussion on diffusion tensor imaging. This is what diffusion tensor imaging looks like of the corpus callosum. So again, the white matter structure here. And what has also been documented is as the corpus callosum heals after a brain injury, it heals from the back to the front. Most interesting is that the front part of the corpus callosum innervates the front part of the cingulate gyrus, called the anterior cingulate gyrus. The anterior cingulate gyrus is hugely important for emotional processing. Very important for depression. You want to know where the sad area is? Sorry, I hate rhetorical questions, sorry. But the sad area is right here. It's called the subcallosal cingulate gyrus. People who have depression, they can take probes and stimulate this area and make them feel radically different by electrically stimulating the subcallosal cingulate gyrus. And this area will actually atrophy, it will shrink in patients who have depression. So now if you're a retired contact sport athlete, or you've had a lot of head impacts playing high school, whatever, then here in the front part of your corpus callosum, maybe because there was damage here, where do these axons go? A lot of them go right here into the cingulate gyrus. So that can be a profound deal for you. So why not get this assessed? Because now it's different than 10 years ago. 10 years ago we didn't know. Now we have the information that's pretty convincing where DTI is becoming the gold standard. I'm going to say becoming the gold standard for validating head injuries. And then volumetric MRI is also very useful in understanding one's brain. And then here, this is disrupted white matter microstructure of the cerebellar peduncles and scholastic athletes after concussion. What are the cerebellar peduncles? They're another white matter structure down here connecting the brainstem to your cerebellum. Your cerebellum grows out of the pons, basically, which is the middle part of your brainstem through here. And so the cerebellar peduncles are holding your cerebellum to your brainstem. So they see damage to the cerebellar peduncles in head injury patients. Why is that important? Because I talked about POTS, POTS and orthostatic hypotension. 70% of post-concussion patients have vascular dysregulation. Where is it coming from? It's likely coming from damaged cerebellar brainstem networks, because when you stand up, your inner ear sends several signals before you even start to stand up. And as it's sensing the motion of you standing up, it is coordinating through what's called your autonomic nervous system to get blood back up to your brain, in addition to what everybody in physiology learns in terms of the baroreceptors and the carotid sinus and other areas. So not only do we have receptors in our carotid artery that sense, like, if pressure goes down, hey, we got to pump the heart harder and we got to get the blood from the legs up to the brain. Your inner ear is coordinating through your cerebellum to get that blood up to the brain. So if you have damage to your cerebellar peduncles, well, that may be disrupting the communication there. Okay, and this basically says everything that I just said, so go ahead and read this if you feel so inclined. And then we say, okay, we also want to, maybe you live in an area where there isn't diffusion tensor imaging. Maybe you live in an area where there isn't volumetric MRI. So maybe you want to go get neurocognitive testing. That is common. But eye movements are another exciting area of diagnosing and predicting who will develop post-concussion syndrome. This gentleman is named Michael J. Ellis. He's a neurosurgeon from Canada. I believe he might be at Toronto Western. Actually, I don't think so. I think it says University of Manitoba. Nonetheless, MJ Ellis is a big-time researcher in the traumatic brain injury world. And what he observed was vestibulo-ocular dysfunction in patients, pediatric patients who developed post-concussion syndrome. And he basically would study them, and he found that those who had symptoms like nausea after the head injury, and particularly if they had those symptoms with eye movement testing, and then if they scored abnormally on eye movement testing, like moving your eyes rapidly from point A to point B, or following, let's say it this way, following a target smoothly from one side to the next, or looking at a field of dots moving past them. If they had abnormalities there, abnormalities in near point convergence, seeing like, okay, at what point do you see two different numbers, or for example, that predicts who's going to develop post-concussion syndrome. Why? Because eye movements are one of the most well-researched aspects of brain function. So we can measure how you think. That's called neurocognitive testing. The impact test is one of the most common ones, but we can also measure your brain function through your eye movements, because eye movements are very well mapped out for frontal lobe function. If you're moving your eyes quickly from point A to point B, eye movements are very well mapped out for the cerebellum. If you're following a smooth pursuit activity, looking at dots moving past you tells us a tremendous amount about the brain. And so when somebody's not able to do that, that can be a predictor of post-concussion syndrome. And then blood tests, again, this is just an article talking about S100B. There's GFAP, as I talked about. There's neurofilament proteins, I believe neurofilament light chain protein. And so then here, how do we get it all better? And this is an article by Dr. Ellis. And I think this summarizes it pretty well. So here he's saying you have to do, a medical assessment, clinical history, rule out more severe traumatic brain injury. So does somebody have a brain bleed? I'm not saying not to get a CT scan or MRI after head injury. Absolutely, you need to do that to make sure there's not a bleed or subdural hematoma, something like that. But if you don't have that and you're told you're normal, know that you're probably not normal if you're not getting better. And that's the whole purpose of this entire presentation. So now we're at this point where we understand all these facets of mild traumatic brain injury, from brain inflammation to gut inflammation to altered hormones to damage to the white matter tracts, of the cerebellum, perhaps affecting blood flow. Now what do you do with it? You need to do vestibular rehab, vestibulo-ocular dysfunction. So he's talking about targeted vestibular and vision therapy. That's one of the main things we do at Gates Brain Health. Autonomic dysfunction, exercise intolerance. So look up the Buffalo treadmill test. So finding out at what point can somebody exercise without symptoms, and then finding at what point the symptoms come on, looking at the heart rate, and then exercising them in a graded fashion to where they're then able to exercise at 80% of their threshold, as an example. That's really, really important. I will also say for those who have vascular dysregulation, you may want to look at exercising in different planes of movement, because if you're running and you have horrible POTS, that may be just too much for your system at that point in time. Cervical spine dysfunction is very important. So targeted cervical spine physiotherapy, and physiotherapists, athletic therapists, chiropractors. So this is where a functional neurologist who has a background in chiropractic, in my opinion, is so well suited to deal with the post-concussion syndrome patient. Now, these are three great pillars, but again, there still are the pillars of what's referred to as functional medicine concepts. So, your gastrointestinal microbiome, also what's happening with your blood-brain barrier, what's happening with your hormones. All these facets need to be assessed. And then concussions, repetitive head impacts, and CTE. So this is the landmark article by Dr. Omalu, as I said in the CTE broadcast. Huge homage to Dr. Omalu. In the world of science, once in a while, pretty significant figures emerge. I would say at the level of a hero, in the way that some people are maybe ostracized, maybe denigrated, and they stand up for what they're observing. And he stood up for what he was observing, and it was a serendipitous event where he was this neuropathologist working in a forensic autopsy facility, and he happened to come across a retired athlete who is suffering significantly with all these symptoms. And Dr. Omalu, because of his persistence and tenacity and in his inquisitiveness, basically he dug deeper and did the brain slides on the brain and basically discovered this chronic traumatic encephalopathy in athletes outside of boxers. And so he deserves a ton of credit, in my opinion. I get goosebumps talking about it. And then Dr. Ann McKee, she's also a heroine in this world of chronic traumatic encephalopathy, basically demonstrating that like 110 out of 111 retired football players, professional football players, had signs of CTE. I think it was 91% of college football players. I mean, these statistics are staggering. And so they're basically demonstrating these signs of chronic traumatic encephalopathy in athletes we didn't really realize had it. It's been long acknowledged in boxers. It's referred to as being punch drunk or dementia pugilistica. So these two people have really put this on the map, and they've come under a lot of harsh criticism. And if you want more information, watch YouTube videos on them, read about them. But I want to thank them for their work. Nonetheless, here's a pretty great slide from Dr. Ann McKee, where basically you can see the signs of tau. That's what's fluorescing here in the maroon color. So this is no tau. This is tau protein showing up. We see tau protein in things like Alzheimer's disease, but the tau protein in retired, or let's say it this way, the tau protein in chronic traumatic encephalopathy is in different areas. It's in perivascular areas. It's more in the frontal lobes. It's in these, what's referred to as the sulcal depths. It's in a different pattern than other types of dementia like frontotemporal dementia. It's in a different pattern than Alzheimer's disease. So, and she's found it in 20-year-olds. She's found it in, I think it was like 3 out of 18 high school athletes. So we're seeing this in a wider spectrum than we ever thought, which is changing the way we view brain injuries. And so that's the talk. So I really hope this is helpful. If you have any other questions, go on our YouTube page, Gates Brain Health, our Facebook page. Send them to us at info@gatesbrainhealth.com. But I really hope this is helpful. Please share this with anybody you know who's suffering with persistent symptoms of MTBI, or they've had subconcussive head impacts and they're worried about brain health. If you have any questions relative to your case, let us know. And I hope this was good. So that's it. Okay, so none of this is a surprise. I'm just reading questions. Is DTI available in Reno? Not to my knowledge. I have MDS, just I have brain damage. Yep, exactly. I had a car accident 15 years ago. I think it's getting me now. Yep, exactly. And car accidents, whiplash, can create brain strains in and of itself. You know, here's a great question. Maybe professional sports players can get these expensive tests. The rest of us can't even get our doctors to believe us. I agree with the latter statement. And there are areas of the country that have very affordable cash prices for these tests. So, and thank you everyone for joining. And yeah, exercise is hard when you don't even feel like exercising at all, or you're going to fall. Very true. So thank you everyone, and I hope you have a great Saturday, and I will see you on Wednesday for another talk.